He is active association, serving as honorary deputy secretary, honorary secretary, national vice president, and then national president. In parallel with president of Nigerian Medical Association 2013 to 2018. He's a member and patron of several NGOs and charity organizations, some of which he co-founded. He worked closely with like minds in 2003 and 2007 political activities. Professor Ogirima contributed actively to the political development of his community and the nation at large. One thing that has been left out in this is that he was defeated at senatorial district in his community. And as a Sojourn, he knew when to retreat. And I think he has retreated and is keeping himself in the classroom, not bothering with the politics outside. Awards. He's a man of distinction in all his engagement. He won the best graduating student of St. Augustine College, Kaba, Kogi State in 1980. George Eddington's Prize in Pathology for the best graduating medical student in pathology of ABU 1987. The President National NYSC Honors Award in 1989 for the best copper in Rivers State. Recipient of Rivers State National Youth Service Corps NYSC Chairman's Award for the most loyal and dedicated corps member during the 1988-89 service year. Best corps member during the 1988-89 service year, Merit Award in 1997 by Social Front of Ibira, Lagos. Awarded a Member of Honors roles of Association of Resident Doctors, National Orthopedic Hospital Igbobi Lagos branch in 1997. He was also awarded AO Scholarship as a fellow at Trauma and Reconstructive Surgery Department of Universität Klinikum Ulm, Germany in 2002, and Kogi State Media Foundation Special Honors Award as a worthy ambassador of Kogi State in 2010. He also had several certificates of commendation from numerous organizations and communities and centers, and he worked as a dedicated and trustworthy physician of repute. He has led the medical teams on 2 occasions for the Christian pilgrimage to Jerusalem in 2003 for Kaduna and 2008 for Kogi State. In 2019, he was nominated to the Senior Executive Course SEC 41 of the prestigious National Institute of Policy and Strategic Studies, Kuru, Lagos. Community development. Professor Ogirima inherited almost an empty department in Zaria in 1998, but 24 lecturers and consultants, among whom are 5 professors today. He coordinated the first indigenous free medical mission to Kogi Central in 2003, where various medical experts drawn from many countries were accommodated in Okene for 1 week of free medical and surgical services at the Okene General Hospital. This humanitarian mission, which was generally applauded by all and sundry, provided succor to the indigent individuals in the area. Even in October 2011, after his political misadventure, yeah, it was written adventure, but I said misadventure. He actively directed by surgical wing of the first medical mission organized by Mark Anuma Medical Mission, MAMM. A lover of his community, Ogirima has always been involved in community mobilization for development Right from childhood, he had participated actively in several projects of Otutu and Dogido World. He donated to the world some items to step up the voltage from the PHCN network. From the time he graduated as medical doctor, even with meager resources, he offers scholarship to deserving children, biological and non-biological. From a land who are at various positions in life as medical doctors, engineers, administrators, economics, and lawyers. This stems from his philosophy of putting high premium on human capital development of the nation in general. He facilitated several admissions to numerous students into several higher institutions of learning. He continuously empowered close associates for SMEs, and he sunk a borehole to cater for the perennial shortage of water in his world. His private life, he fears God, but fears no mortal. He's happily married with 5 children. He loves listening to tribal cultural music of any tribe and race. He loves discussing politics with like minds and loves exploring men's potential. He would like to leave any contact he made in life with a smile. At this junction, I think I should stop reading because there are many pages. I think I should stop here and listen to it instead of listening to about 20 pages of citation on him. Thank you and God bless. May I invite you to do your present.
Sí, sí, sí.
Mr. Vice Chancellor, sir. I don't know how you got those details, but thank you, sir. The Deputy Vice Chancellor, Academics and Administration, members of the University Council, the Registrar, the Bursar, the University Librarian, the Provost, College of Postgraduate Studies, Deans and Directors, Heads of Departments, eminent professors, members of the University Senate, distinguished colleagues, teaching and non-teaching, invited guests, particularly representative of our fathers. These are the beings next to God in my life, the royal fathers. Other invited guests, my dear students, ladies and gentlemen, gentlemen of the press. It's a pleasure to present the 32nd inaugural lecture of this great institution. Of course, the outline of my presentation is as shown. Of course, the citation has been ably covered and over-covered by my boss, the Vice Chancellor. I will go ahead to present the lecture. Orthopedic researches, both ancient and now. My research activities, the impact of private hands in medical education, traditional bone setting in Nigeria, my contribution to knowledge, future research interest, the challenges one has faced in the course of this journey, way forward. Mr. Vice Chancellor, sir, the delay in giving my inaugural lecture arises from 4 years of delay in the pronouncement of my rank, the exploit into professional leaderships, The NIPS experience, COVID-19 pandemic, which I was a victim twice, and the call to duty to this great institution. This is God's time, with more juice and maturity to sit well on the chair. This is the first inaugural lecture from orthopedic departments in Zaria and definitely Lokoja and the college since their establishment. The choice of the lecture title arises from several gadgets, either as tools or hardwares, that are needed in the practice of orthopedic surgery to achieve success. In resource-poor setting, the need to think outside the box to meet up with the demands of many indigent patients in the presence of high cost. Hence, the need to adapt, innovate, and improvise with cheaper alternatives to achieve great and comparable outcomes with the imported ones. The concept of hardware used in surgeries are brought up by the surgeons themselves, but the design and production are perfected by the engineers. Hence, the need for interprofessional collaboration. With the field of engineering, this is called biomedical engineering, which Mr. Vice Chancellor is already dreaming to establish in this university. I shall chronicle my research findings and exploit to review my journey as a surgeon in the last 29 years of my life. Some of the flashpoints that have been mentioned in the citation, of course, I have lived not to fear any man. And the more the depth of your struggles in life, the greater the height of your success. That is R. Kelly. One is born to live by divine blessings of innate talent shaped by hard work and effort. I have a nomadic fashion of my existence and career progression, as you have listened. My navigation around various obstacles in my sojourn through Zaria in 25 years and in the last 224 weeks in Lokoja started with my appointment as lecturer 1 in Zaria in 1998 and a consultant 2. Of course, then there was the declaration that there was no vacancy. The resuscitation of the orthopedic department at Kaduna Annex of ABU Teaching Hospital commenced with personal trade and innovative maneuvers against solo practice with other surgeons in various fields. I thank God always for his faithfulness. The surgeon's journey is an unending quest to refine skills, expand knowledge, and deepen compassion. Greatness, in this sense, is not an achievement bestowed at a single moment, but a destination reached through steady improvement, humility, and perseverance. The surgeon is a passage through which the surgeon confronts the fragility of life, heals with purpose, and affirms the value of human existence. Sojourn reminds us that this journey is not permanent. It is a passage, a moment in time, a narrative of service framed by transience. Every contact, therefore, in counseling, bodily manipulation, with or without application of cast, incisions I make, the divine healing received on every patient encountered along the way become part of a larger existential journey that mirrors our own human passage through the world. The sojourn mirrors the human journey itself. Our shared striving from imperfection towards excellence, from limitation towards transcendence. The sojourn speaks both to a profession and to a philosophy of life. The surgeon stands as one who daily engages the fragile threshold between life and death, wielding knowledge and skills, not merely as instrument of science, but a gesture of hope. The sojourn, therefore, is not only a medical pilgrimage, but also a metaphor for the human condition, an odyssey of purpose, sacrifice, and meaning in the face of life impermanence. Taking care of accident victims via orthopedic rehabilitation is a tortuous journey of not merely a hammer and nail factor, nor a hand glove and cast, but my passion and my life. Let me go quickly, Mr. Vice Chancellor, sir, to the concept in the making of an academic in medicine and being involved in medical education. Of course, to be an MBBS holder, it's a tortuous journey with an appointment into civil service at a very higher rank. Then you enter the stage of specialization, another 7 to 8 years of postgraduate education. Of course, it ends with appointment as lecturer 1 and consultant orthopedic surgeon. If you want to go further, you go into subspecialization, because in orthopedics, we now have the hand surgeon, the spine surgeon, the arthroplasty surgeon, the arthroscopy and sports medicine, the foot surgeon, the oncology surgeon, the pediatric orthopedics, which is an additional knowledge-seeking venture. In modern orthopedics, orthopedics was coined by Nicolas André, a French professor in 1741. He coined the word from 2 Greek words. Ortho means to walk straight, while pedia means child. So orthopedic surgery was preoccupied with correction of childhood deformities. In his book, which is well written in French and translates to the art of correcting and preventing deformities in children in orthopedic surgery at the University of Paris, he depicted orthopedic practice with a bent tree supported by a straight wood bound together by a straight rope. This is akin to fixation of fractures or correcting deformities. Frank Dixon, in 1935, while giving the presidential oration of the American Academy of Orthopedic Surgeons, described orthopedics as a wide field and one that demands the broadest of medical training and deep, if not profound, knowledge. Orthopedic surgery is that branch of medicine that deals with the care of musculoskeletal system disorder, particularly the locomotive aspect of the system. There, in the ancient time, and now, patients are kept in constant motion while under treatment, according to the dictum of Moshe Fendikaris, 1904 to 1984, an Israeli physicist who found a method of self-awareness through movement now, popularized by AO Group. Life is movement, and movement is life. The orthopedic surgeon doubles up as a physician who is well knowledgeable about the applied anatomy, both normal and pathological, and physiology of the muscular system. Of course, that is the Nicolas André who coined the word orthopedics. And that is the symbol of orthopedics anywhere in the world. It's a very deformed tree supported by a straight wood and intertwined by rope. What are the other pioneers of orthopedics? Of course, the biblical statements are profuse in the practice of orthopedics. In modern times, we have so many pioneers, the Buckinstars Brown and Lewis Serra from USA, the huge Owen Thomas, from which we, from this side of the world, derive our own knowledge of orthopedics based in UK. Of course, the German Gerhard Kuntscher, who designed the Kuntscher nail that was popularly used in World War II. In Switzerland, we have 5 Musketeers who designed and studied extensively the fracture of bones in the 1980s. Of course, I had the singular opportunity to spend my post-fellowship scholarship in 2006 in these centers in Switzerland. These are the pioneers. You can see the huge Owen Thomas there, and you can see Professor Sir John Chanley, who studied the tribology of fractures, and particularly around the hip. He is the father of modern arthroplasty, hip replacement we now do often. Here in Nigeria, in Zaria, in 1980, our department was carved out of surgery. This was pioneered by Colonel Dr. Osad Osamoyi and Professor E.I. Mbamali, both are late. Then the living sage, Professor C.G. Iwebu, at 80, he's still operating and kicking fine in Ogara. At Ife, we have E.A. Bangoye, Z.O. Alabi, G.A.A. Oyemade. In Lagos, we have M.O.A. Jaja, Festus Olani Adeole, whose son is already a professor of orthopedic surgery and the chairman of the West African College of Orthopedic Surgeons. We have F.A.O. Owoshina, J.J. Grange, B.O. Onubogu, and B.O. Onaboale. These were my teachers, and they are late. May their soul rest in peace. In Enugu, we have people like Osime, and in Benin, we have F.A. Orewere, who moved from Benin to establish orthopedics in Sokoto. Why my choice in orthopedics? Maybe a divine call. Early childhood experience in the care of a close relation with orthopedic ailments must have added that. Then my good mentorship by my teachers. Then the fascination of cast application. Here you have a very powder, material, and when you soak it and apply it to a human being limb, it turns to a very hard rock. Very fascinating. And up to today, I still love applying cast. Then there was a crossroad in 1994 when I was to move to my final stage of orthopedic training. Here I had a professor of pediatric surgery who engaged me 24 hours a day, solving pediatric surgery. That is Professor J.T. Momo, who himself had japped to Canada since then. Of course, Professor E.I. Mbamali and Professor Godwin Iwebu are depicted there. Of course, the great spiker, the hip spiker was applied and in place to treat a hip pathology. Orthopedics and other fields. Mr. Vice Chancellor, sir, orthopedics dines with many other fields. These are medical rehabilitation therapy, which deal with physical, spiritual, exercises, muscle massage, and manipulations. In plastic and reconstructive surgery, we have soft tissue. All soft tissue must be healthy before you can achieve bone healing. In engineering, you have adapting, fabrication, improvisation in the treatment of different diseases using obsolete tools in the past. These are some of the obsolete tools that were in use. In fact, it is pertinent to know that we have the iron lung for the treatment of poliomyelitis. Just last year, the man Anderson died 73 years while being managed in the iron lung for poliomyelitis. If you extricate him before then, he will succumb. But he was kept alive for 73 years, and he died just last year. Then we have the 20th century treatment of club foot by Hugh Owen Thomas. You could see him in action using a wrench to correct a club foot. There are stages of orthopedic researches in Nigeria. I divided them into pre-1990 and post-1990 period. The pre-1990 witnessed the Zaria metal hinge joint that was designed by Professor Iwebu in 1984. He also pioneered the field of plug osteotomy to treat avascular necrosis in sickle cell anemic patients. And he was involved in so many, textbooks of orthopedics that were, edited by him. Post-90, we are now preoccupied with reconstructive surgeries. Increased civilization with tendencies to refined foods comes with prevalence of non-communicable diseases like hypertension and diabetes mellitus. Increased longevity, relatively, of our population comes with degenerative joint diseases and joint replacement surgeries are on the rise. Death of modern instruments because of poor exchange rate of foreign currencies. Then the trauma, road traffic injuries, gunshots, sepsis, chronic osteomyelitis, implant and periprosthetic infections are some of the researches one has undergone. My research work stemmed from the fact that there were lots of innovations and improvisations. In 1997, I was a mentee to my great teacher, G.T. Adebule, who now devised a method to remove a bent nail inside a refractured, thigh bone, which we call femur. Then after graduation, I used so many collapsible intravenous container and accessories as closed wound drainage. It was bad to use that method because patients cannot afford to buy drain. Even up to today, that improvisation still works for our patient. There are intravenous stylet used as external fixators, particularly by my colleague in reconstructive surgeries of the extremities and injuries to bones of the hands and feet. This was Asuku and myself in 2007. Then we went into bloodless pain-free surgeries of the extremities, such as excision of small tumors like ganglion from the hands and feet without anesthesia, without general anesthesia, but with local infiltration. Then we also use that with an expert bandage. Expert bandage is also scarce. We have to improvise too with an old tire tube. Then we had massive bone graft and polymetal acrylate, what we call PMMA, and we call it as a bone cement in the management of bone gaps from benign bone tumor excision. We also went into utilizing autologous bone, harvesting a bone from another region of the body to use it as a strut, as a gap to mend a gap in the bones. Then I was involved in the importation of the franchise of Advanced Trauma Life Support Program, which was solely, a course that was organized overseas. So in 2009, we were sponsored by a philanthropist to go to United Arab Emirates to study the ATLS. And 3 years following that, we now had to import it into Nigeria. Every postgraduate colleges now are using that method, given the courses in Nigeria. Of course, that was the first research I was involved, the bending of a nail, and that showed the mechanism of the bend. When you fix a nail into the bone, it has to heal the bone. But in this case, the bone has to refracture and the nail was bent. How do you remove it? So we devised a method to remove it. Of course, improvising with a drain, as of recent, that drain in color is still being used in the country. The use of cannula. Each of these cannula using this cannula, what you need is a K wire. We call it Kirschner wire. Each one now costs about 3,000. So we have to improvise this, and we got the same result. The use of bone cement in filling bone gaps was utilized here. But the difference between what we did then and now is that inserting this iron into the hip, you need an image intensifier, which is available everywhere now. So that is the image intensifier at work. All these nails and the implants, the iron you are seeing as shadow, have been inserted using the machine on the left, what we call the image intensifier. You don't have to open up. All you do is pinhole and you fix the implant. Of course, this is the couple that sponsored us to United Arab Emirates and subsequently imported the franchise of ATLS. To see our colleague who was the staff, the faculty staff we use from American College of Sojourn, Committee on Trauma, and we lost their leader just last year. The other exploit was in bone and joint surgery, a disease among all age groups, but commonest among children. Low immunity, malnutrition, blood discresias, and trauma, both from injuries and infected hardware, are responsible for the infections. More than 80% are through the bloodstream from the primary site, like scabies or tonsillitis. Acute, subacute, and chronic in types. Progresses mostly from acute to chronic. The acute types are commonly missed by inexperienced practitioners, particularly during the febrile or feverish stage for malaria and typhoid. Fever can be caused by so many things. I have never treated typhoid more than once in my life as a practitioner. So typhoid is not that common. Chronic type is an occurrence of both destruction and formation of new bone with an infected soft tissue envelope. Treatment of acute type is essentially medical with heavy antibiotics, but that of chronic type is mainly surgical with the removal of dead bones, which is we call sequestrum, and attention to the infected soft tissue envelope. It may involve the services of plastic surgeon if we have a very wide soft tissue defect. Chronicity often leaves recurrence if more radical treatment is not employed, with scarring too. Of course, these are the various types of bone infection. You could see the long bone lying horizontally. You could see a small bone as if it is within the bone. That bone is dead, and that is what we call sequestrum, and that sequestrum must be removed. Of course, in trauma, we had several experiences ranging from gunshot injury to road traffic injuries, and you could see the treatment. There are these cross wires that are there. These are the occasional wire, which are very expensive. In musculoskeletal trauma, so bones and joints arise from road traffic injuries, falls from height, domestic animal accident, sports, firearms injuries. Our accident units are heavily, more than 80% preoccupied with trauma cases and accounting for over 70% of all surgical deaths. The active age group affected by trauma is between 25 and 40. These are the active, very productive age group. Males are commonly affected, though there is an evolving female visibility because the females are becoming more mobile for economic reasons. My findings in the extensive case into civilian gunshot injury in Lagos in 1995 revealed enormous burden from this type of injury. The study became a template on which several researchers ventured into extremity injuries from missiles in West African sub-region. By studying the appearance of wounds and radiograph of part of the body shot, we can deduce the caliber of weapon used and the extent of injury expected. These findings determine the choice of treatment of the shot bone after stabilizing the victims. The treatment of fractures involves several methods with use of gadgets that are expensive as shown in figures 21 and 22. Occasionally, the deformed bones need more complex surgeries of bone gap care and equalization of limb length discrepancies. Late presentation, majorly from traditional bone setters meddling, may cause more sepsis, limb loss from gangrene or death. There are calls for improvement in the care of trauma cases from the same of from that studies. These are the various trauma cases that one has seen and the treatment, of course, ranging from dislocation of the joint, which is very rare, anterior dislocation of the hip, which we have reduced because this patient presents within 2 hours of fall from a Helios bus. Then we have a fractured neck of femur in the elderly, which we now treat with replacement of the joint with metal. Of course, we now have other method of treating bones, particularly open, fractures with, very ugly wounds. So we have the linear rail system, the orthofix, and the AO, or ASIF, that is Association for the Study of Internal Fixation Fixator. Then we have ring fixator, which is so versatile that we can use to increase bone length or even do so many other maneuvers. Of course, the gaps in bone can be, treated by using plates, what we call plates and screws. And you can see a bone within that bone that is fixed. That bone was harvested from the fibula, and it is being used to treat that gap. Complication from treatment. It is all not all is rosy, but we are faced with complications sometimes, which may involve the gangrenous, effect of the whole limb and the exposure of the bone with shortening of the limbs. Next is metabolic diseases affecting bones and joints. The drift from our traditional diet to highly refined Western diet is being rewarded by increasing rate of non-communicable diseases, as I have mentioned before, like hypertension, diabetes, and renal diseases. We studied the prevalence of diabetes and its complication involving the extremities in Kaduna in 1999, arising from increase in the prevalence of diabetes mellitus and its complication. In Lokoja, the incidence of diabetic mellitus is high, as more complications are referred to our unit for salvage surgeries. On average, we receive one case of complicated diabetes mellitus with extremities every week. Diabetic mellitus accounts for more than 60% of all amputation in Lokoja. Early diagnosis, aggressive care, and good surgical decision, as advocated by me in 2001, still persists as the gold standard of treatment. Rickets, hyperuricemia, and bone dysplasias are responsible for so many angular deformities and joint degeneration in our own environment. These are some of the angular deformities caused by rickets or by blount, and we have subjected them to surgery to correct it, to straighten the bone. After correction, you fix the bone with POP, and of course, that is the outcome of one of the cases we handle. Other research works include congenital or hereditary orthopedic lesion. These are lesions whereby newborns are born with deformities, where orthopedics actually started the fame from. Children born with musculoskeletal disorders receive care under me like any other orthopedic surgeon. Our findings in 2007 in Zaria revealed wide spectrum of congenital deformities of the limb. These children are usually brought late by parents because of ignorance, poverty, beliefs, and many are lost to follow up because of cost of follow-up. So aggressive awareness programs are needed. Non-governmental organizations are rising to this task. For example, we have the Straight Child, the Miracle Child. Hands are few within our reach. Cases seen include clubfoot, which is the commonest congenital lesion we see, 1 in 1,000 population. We have spinal dysraphism, which are swelling along the back, or extrophy of the bladder. The urinary bladder is exposed to the outside, or congenital dysplasia of the hip, or gigantism. One limb can decide to be, very mighty with extra digits. So we take care of that. Causes are not known. Causes of these congenital lesions are not known. I think from my own, hypothesis, it is another phase of God. I won't say it's the devil because we are all born to resemble God. If you are crooked or straight, just thank your God and accept God's done. But science has some remedies. Sickle cell anemia carried bone and joint complication, among other crippling effects of the disease. Hemophilia can lead to joint destruction from recurrent bleeding into the joint. And these are some of the congenital lesions we have treated, from arthrogryposis, like stiffness of a child, and club foot, and you think it's a dimple of beauty. When you see this dimple and the abnormal crease, skin crease, you look for hip dysplasia. Of course, we have bilateral hip dysplasia that has grown into adult. What of my first into degenerative joint diseases? 60% of outpatient consultation in orthopedics are due to back pain among the adults. It is associated with high level of loss of man hours at workplaces. Degenerative low back joint diseases have been associated with manual workers, as housewives accounted for 35% of the backache within their first year of marriage. Other causes of back pain are infections, particularly tuberculosis, repeated trauma from sports, road traffic injuries, professional acrobatics, and rigorous dancers. Secondary and primary tumors, congenital absence or incomplete vertebrae are some of the causes we published in 2000. We advise for early attention to back pain, particularly in adults between 31 to 50 years of age, for adequate evaluation and treatment. These degenerative changes respond well to postural adjustment, common non-steroidal anti-inflammatory drugs. Few may need spinal injections, minimal access surgery, or open surgery with or without instrumentation. Degenerative joint diseases are progressive and causes are not too different from the ones that we saw in back pain. Good evaluation will need to cure. We need the cure from medications and joint replacement surgeries. These are some of the degenerative joint diseases like osteoarthritis of the hip that we need total hip replacement. All these surgeries can be done even in Lokoja here. The knees can be affected with arthritis, and they are being done in Lokoja here. Of course, there are other acquired food from polio. So we also looked at cancer. Not all of them are cancerous. Gadgets to deal with this entity. Surveillance of bone if patient presented. Of course, you could see the tumor of the bone can spread into the system. So any ulcer you have, which has become ulcerated, and as depicted here, can be removed. Colleagues, particularly, we equalize link. As I have said before, is fractured for so many months, lengthen the muscle, and it can be released. But we have seen gangrene occurring. We have seen manifest personality disorder led into amputation. Femoral neck being able to walk straight. When gangrenous, the feet when gangrenous push. Of course, for a dead part. What is dead? From typhoid, we can, in 5,000 cases, the one I saw during my practice in the last time, to walk on its own. And once you we severe it, has played a complementary role in private hospitals that are already using Anatomage, Advanced Medical College, centers, well-equipped public health institutions trained deeply to stem the. It's our hope, therefore, that survives. My remark on the usefulness that of traditional birth attendants. The traditional bone setters are any blunder with this, if the cost or this poor staffing of public health colleagues, Onomia JE, and other fracture care, therefore depend on TBS, their patient. They now use POs and death of the patient. In global knowledge dissemination, Mr. Vice Chancellor, sir, you are medical lab science to train. Biomedical engineering are going to be in the next phase. Behind 5 professors included the importation of the franchise with the ATLS. already with Canadian firm, a national research center in Cairo to two-brand constitution of more orthopedics hospitals have and funding for universal health. Chancellor, sir, I would love this in limb reconstruction and patients in our resource. Number one is for the needed fund and they got the infrastructure and researches within the last 2 years. Medical tourism, which is medical tourism. It is the children cannot be trained of interest by private firm to key in and be rewarded heavily. And lack of rehabilitation. Few minutes, I have carried out numerous programs of numerous indigent patients. Paying out. This demands some who have stayed back to contribute, but demands a passionate one. There is no retirement. Your body may receive a referral to see you. The need to so much promise and demand every contact I make with in a manner that will bring glory. Mr. Vice Chancellor, sir, I cannot make recommendations. I can way forward that can be adopted and researches. That is so many ways of funding that imported the franchise of it. Health insurance to care in joint replacement. Number three, the third function. However, if the sisters, the need to enforce. Number four, government is a university. The medical program, my vice chancellor, university should have between within university. Available the few medical teachers left in the assisted tools in Egypt. Number seven, this was the policy when I would revisit the old order, their tenure of counselors, managed by teaching hospitals, telecom and surgical skills lab. This will come in hand for both elective and, to greener pastures. Number 9, established in various well-organized. Number 10, the access of work with ambulance services should be established, ranging from a dying patient on our road. Facilities, both private and public. And lastly, there should be robust monitoring medical education. Lecture, things he has done in my life to date. College in Lokoja for many universities. I have asked me to my principal officers, the bossa, and I thank you all. To thank in the first week of coming to Lokoja, so MS Audu, Professor Hadid. I thank you for being my teachers. I want to thank particularly, I thank you and God bless you. Because I'll start mentioning everybody. And to my doing best well and give time. A friend of the university, they have supported me. She's been a wonder to my children. I have not regretted moving from you. I thank you for and promptings from mommy. For your rapt attention.
Stand up for the champions, for the champions.
Side JJ532FY.
Distinguished guests, it's been a very apologize. I will be very graphic. We apologize that we didn't. Thank you all for being basis. This place is always so. It's my pleasure to respect vote of thanks.
Today, we see that when we came together for the first time, before I came in the waiting room, I was also in the waiting room. Who's fat, who is big, who invited us in. The person, so that was how we met at our College of Health Sciences today. Because I saw the passion for politics. But this is his, and we sacrifice a lot. I said, but what you are giving back to the soil, surely appreciating you today. That is the humility of always have it's a provide a very good aid. So I want to thank you again. You give the lecture, nobody what he has said, and you cannot question the person. The lecture he has given, making reference to me that bring out of this lecture. And medical tourism, nobody should go out. Go to National Assembly now, going for your medical checkup. That is the point. They're up to 5% of the population. And every day, every Sunday, we are only using mouths to develop our health sector. We must, as teaching hospital for different sectors, you understand? And even the one is why we must come together to, fortunately, if I've gone to included in this third fund something, is the issue of way of making money. Keep that titles everywhere. University established, so I want to appreciate the government for stopping university in every local government take very serious. I want since of College of Health Science, we have medical as a result of your especially appreciate. I want where are you, sir? Thank you, sir. You are aware of Adabi, Alhaji Mohammed of Ajaokuta, sir. Thank you. You are welcome, sir. Yeah, His Royal Highness, sir. His Royal Highness, Honorable Justice, Shiamari Court of Appeal, Kogi State. Kogi State, and former chairman of Ogirima is no go area against. That's, you are welcome, sir. Also among us, you are welcome, sir. Major Aruno Tunde Sholagberu, Sholagdi of Kwara State, Professor Solomon Aru, Lazarus and his wife, say, Honorable Nani, Sarah. We have some brother, the acting CMD Federal Teachers Force, SCT, you are welcome, sir. Honorable Justice, we have from many people who are Bola, Aikogun, if on we have Dr. Audu, Godwin Adeja, Noja, Professor Taru, Professor Duku, Yahuza Sheu line, ladies and gentlemen, and we have a tradition here. So normally when they Professor MD, please can you step forward, please? Please, can you?
Vice Chancellor, other principal officers, community members, charge and acquittal of your.
Yes, sir. Step forward, sir.
Vice Chancellor, President, Your Royal Highness, MJ Usman, President Customer.
Take your leave to do a presentation to rep.
Please allow me to stand on behalf of to affect your life in a positive. Ogirima, Prof. From Ibraland, starting from the Union of
Thank you, sir. Yes. Invitation cards. University. She's a mother. I'd like to recognize her anywhere I am.
Much, please, can you put those hands together for my kind permission? I'm extending on press conference on the 13th of October. You put your hands together for how far and the university anthem apply. Thank you. Citizen. Great.
of the greatest FUL
Remain standing. Particularly His Royal Highnesses and this hall